How is the Oncotype DX assay used in planning the treatment for patients with ductal carcinoma in situ? Let me share with you some thoughts on that subject. The Oncotype DX assay has been available now for several years. We use it in women who are estrogen receptor positive with either invasive ductal carcinoma or invasive lobular carcinoma. But what actually has been needed for a long period of time is a very similar assay for patients who have in situ breast cancer, known as DCIS, ductal carcinoma in situ. Well, the folks at Genomic Health have modified the original 21 gene assay, now with what's called a different algorithm, to create an Oncotype DX score for patients with DCIS. Now this score, the recurrence score, is on a scale from 0 to 100, like the invasive assay, but it does something really unique. I've seen on your screen right now is the results of a patient who has an Oncotype DX score of 6. On the left-hand side of your screen, you see a calculation of the local events. In other words, what are the chances of the cancer recurring in the treated breast? This, of course, is in patients who have had lumpectomy. And could that recurrence be either in situ breast cancer or invasive breast cancer? And the curve that you see going up is a curve of the increasing biology of in situ breast cancer. The higher the curve goes up, then the more potentially aggressive the DCIS is. And just like with the invasive cancer, we get a low risk recurrence score, an intermediate risk recurrence score, and a high risk recurrence score. Now, on the right-hand side of this report is a calculation for an invasive breast cancer event within the treated breast. And again, this is in patients who have had lumpectomy, and the calculation is then made over the next 10 years. What are the chances of the cancer not only coming back as an in situ cancer, but more potentially aggressively as an invasive cancer? Now, I've got up on the screen a recurrence score of 6. This is actually in one of my own patients, a 57-year-old woman who had a small 5 millimeter low-grade ductal carcinoma in situ. And as you can see, the recurrence score came back a 6. And again, referring to our chart, this means that over the next 10 years, she has approximately a 10% chance of either a recurrence of in situ breast cancer or invasive breast cancer. And on the right-hand graph, she has only a 4% chance of an invasive recurrence. This is an extremely low score. Now, combining this low score with the fact that the cancer was really quite small, this patient chose not only to not have radiation therapy, but also not to go on anti-hormonal therapy. Now, the validation study that was done to show that this test has validity was a prospective trial of women with ductal carcinoma in situ. But there were limitations placed in this validation study. The in situ breast cancer had to be 2.5 centimeters or smaller in size, and the rim of normal tissue around the in situ breast cancer had to be at least 3 millimeters. Now, the validation study did not take into account the grade of the in situ breast cancer. In situ breast cancers can have 3 grades: low grade, intermediate grade, and high grade. And the low grade in situ breast cancers act extremely benignly. In other words, not very aggressively at all. Where conversely, the high grade in situ breast cancers can act very aggressively and may have within them areas of associated actually invasive cancers. So in blending in this score into how we make decisions about patients with in situ breast cancer, we have to take into account multiple factors. How big was the in situ breast cancer? What were the margins like? What's the grade? All of these factors together, and then couple that with a recurrence score assay like my patient. And I believe that my patient was treated absolutely appropriately with no need for radiation therapy and no need for tamoxifen or any other form of anti-estrogen therapy. Now, recently I was sent a question at breastcanceranswers.com about a DCIS recurrence score of 19. And in general, we don't comment on specific questions asked us at Breast Cancer Answers, but I thought I would blend in a response with a recurrence score of 19 into the graph that I've been showing you. The calculations for any kind of event in the treated breast with a recurrence score of 19 is approximately 13%, or a little bit higher than the recurrence score of 6. So you see as the score goes up, the actual increase in the events in the low-risk group is actually quite small. And also, within the chances with a recurrence score of 19 of being over here with an invasive recurrence, that calculated out to only 5%. The bottom line here is that a low-risk score is a low-risk score. Many of these patients in the future are not going to require adjuvant radiation therapy. I am putting this assay into the use in my practice more and more. This gives us some additional information about what the biology of the in situ breast cancer is like. Just like with invasive cancers, the biology of in situ breast cancers is highly variable. I believe that an Oncotype recurrence score assay is going to be an important tool in helping us make bottom line decisions about how best to treat patients with DCIS. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.